For Patel Like It Is, where Dr. Alok Patel shares some health advice on the topics that matter most to you. And today we're actually talking about health care in the 2024 election. Here's Dr. Patel with what you need to know about the health issues on the ballot.
Healthcare is a big election 2024 topic. For example, this is the first presidential election we're going to have since Roe v. Wade was overturned. And we've heard multiple stories in which restrictions on abortions have affected women, especially those in high-risk pregnancies. Reproductive rights are on the ballot. America also spends more on healthcare than any other high-income country, and we're the only one to not guarantee healthcare coverage. With that, healthcare affordability, drug pricing, access to Medicare and Medicaid are also on the ballot, and there's more. 1 in 5 Americans has a mental illness. Drug overdoses, especially from opioids, claimed over 100,000 lives in 2021, and gun violence is the leading cause of death in children. So, mental health care, gun violence, and the opioid crisis are also topics that presidential candidates should address. From who we vote into the White House to who we choose to represent our neighborhoods, exercising our civic duty plays a part in how we address and uphold public health. Do your research, think about yourself, your friends, your family, your community, and vote like your health and public health depends on it, because it kind of does.
And Dr. Alok Patel joins me now for more on this, along with ABC News senior national policy reporter Ann Flaherty. Dr. Patel, in your video, you say America spends more on health care per capita than any other high-income country, but the U.S. is the only one not to guarantee health coverage. Why is that? And how does that affect the average American? If we don't have universal health care, why are costs so high?
I wish I had a simple answer, Diane, to explain about why our costs are so high, but the reality is that this is something that voters, the average American, should pay attention to in researching their candidate who is governing their state, where they live. I mean, the mere fact is, according to the Centers for Medicare and Medicaid, the United States spends about $13,000 per person on healthcare, which is $5,000 more than the other average high-income country. And we still have about 20 to 30 million uninsured or underinsured Americans, which leads to poorer outcomes when it comes to treating long-term or chronic illnesses. And some of these terms are confusing for the average person, including expansion of Medicare and Medicaid and marketplace subsidies. But the mere fact is that people should really look at what is happening to their health insurance coverage as they're making decisions about who to vote for.
And how are you seeing the presidential candidates tackling health care on the campaign trail?
To talk about inflation, and that's the issue that is top of mind for so many voters. But of course, people forget that healthcare is tied to that. Along with rising prices, healthcare gets more expensive. We saw in a recent poll from KFF, the nonprofit, that 80% of voters see this as a top of mind issue, the cost of healthcare. Now, Trump and DeSantis say that they want to revisit Obamacare. And then, of course, abortion is the other issue that's coming along that people are talking about. That's a major issue. A lot of the candidates not really talking about that, sort of dancing around it. Along with Obamacare, we're not getting a lot of the details on how they want to actually change things.
So, Dr. Patel, how can we be well informed on these issues when they're at the center of the conversation like this? Because we are not all medical experts.
You know, and it doesn't take a medical expert to actually go and look online and research the healthcare topics that candidates are discussing, or to go and look to see what their stances are on anything that's related to healthcare policy, public health, and science in general. As Ann mentioned, reproductive rights are a big topic. And there right now in the United States are about 2 million women who live in areas where there is no access to abortion and no maternity care. That directly affects people's health, their ability to live a productive, long, healthy life. And there's also topics such as mental health care, gun violence, drug pricing, cancer research, maternity care, child care. There's so many topics out there that people may forget about that directly involve both this dance of politics and healthcare. So I encourage everyone out there from a nonpartisan stance just to do your research and research all these topics and how it affects you and your family and your community.
And what are the biggest healthcare topics in the battleground states now?
So the states I'm going to be looking at are states like Arizona, that they're going to have abortion on the ballot next year. That could drive out voters. But also states like Georgia. This is a battleground state that could really make a difference in the presidential election. But it's also about the state houses. Both of their houses are up for election or up for grabs with control. And it's these state houses that are passing laws that apply to things like health care, abortion, all these things that are related to health care. So, I think voters do have all of these issues in mind when they're going to the polls. And I think that's going to make a big difference in some of these battleground states.
All right, ABC News medical contributor Dr. Alok Patel, senior national policy reporter Ann Flaherty, thank you. And Dr. Patel is, as always, taking your questions. Leave a message on our Instagram feed at ABC News Live, and he might answer your question right here on Friday.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.